Are you looking for some orthotics to be able to wear in your shoes? Just something that you can buy over the counter, nothing custom or anything like that, but that will help to decrease your pronation while you're running? Well, I have a new product to review for you here today. And this is going to be one of several reviews. I just did my first run in this product. And realizing that there's different break-in periods and stuff like that, I'm going to be coming on to do a video after each run, give you an idea of how long I ran, how everything felt, so that you can help determine if this is the best product for you. So I decided to do this because while I was out running today, I realized one, the mistakes I had made. So I'm going to share those with you as well. But I realized too that if I waited to do a product review until I tried these out for, 3 or 4 weeks, and I could give you a really objective point of view, right, after 3 or 4 weeks, then I would also have forgotten some of the smaller stuff, right? And sometimes it's the small stuff that's really important because I will have patients who will come to me and say, I had this or I had that. And it's like, is that a big deal? And the question always is, well, it depends. So we're going to talk about all this stuff today and through the videos as we go along. I decided I'm going to entitle this my ponytail series because I put a ponytail in, a little ponytail, while I go running. So I hope that this is helpful for you guys as we go along. Definitely, if you come across any questions with each video or with the series, drop them below because I'd be happy to answer them for you as we move along. So today, our product is the Powerstep. I'll move that out so you can see those. So I just got them on Amazon. The reason why is because I had a patient recommend them. So she has plantar fasciitis. She used these. So her symptoms are mostly resolved at this point. Okay, so she's not a super bad, super hot, like I can't even walk without pain plantar fasciitis. She's when I run more than 2 to 3 miles, I get plantar fasciitis. Okay, so for reference. And she felt like they were really helpful, particularly because they helped her do more of that ball of the foot strike or a midfoot strike. So it decreased her heel strike, and she felt like that was really helpful for her plantar fasciitis. So before I recommend a product to anybody, I want to try it out. So I did my first run in it today. Now, mind you, I do not have any foot symptoms right now. I do not have any plantar fasciitis right now. I have before. So my review is going to be a little bit different, and it's just going to be based on what I felt in my foot, which is, I hope, helpful because I don't have any dysfunction currently going on in my foot. Now, I told you I was going to list the mistakes that I made. So mistake number one, friends, please don't do this. I went for a 10-mile run with my brand new orthotics, which I always tell you guys not to do. If you're using a new product for the first time, you don't go for a long run with it, right? You guys know this. I've talked many times about this. So when you are using a new product, you want to use it for a shorter period of time. So one of your shorter runs. That way, if anything goes super wrong, like you're okay, right? You can be able to get home. I didn't think about it this morning. I had put them out by my running shoes. This morning I got up, went to put my running shoes on, saw the box sitting there for the Powerstep, and was like, oh yeah, that's right. I was going to try these today and put them in. Okay, so first thing, friends, not for a 10-mile run. Not for a 10-mile run, okay? Don't do it. 3-4 miles, okay? Not for a 10-mile run. Not for the first time. So that was mistake number one, which I realized, you'll be shocked to hear, about 3 to 4 miles in. So my left foot is it's my more challenged foot. I don't like the word bad, but it is definitely more challenged. My left foot has difficulty hitting the ground correctly, which puts more stress through my left knee, which decreases the muscle activation in my left hip, which causes my left ilium to go cattywampus, and every once in a while my pelvic floor to just go south. Okay, so it's all my left side. That's where I have more of my struggles. So, of course, the Powerstep influenced my left side. Now, when I started running, I didn't feel it at all on my left side. I felt it pretty prominently on my right side, which was interesting because, again, my left side's my more challenged side. I really felt it on my right side. I'm standing in them actually right now, and that's still true. Even after a 10-mile run, I can feel it on my right side, and I don't feel it on my left side. Okay. But after it was probably about 3.75 miles, I was running on a sidewalk because I had to at that part of the road, and felt a lot of pain in my lateral heel. So it's right where I could feel it, is right in that joint, right where the talus and the calcaneus meet, and the calcaneus was not able to, it was not interacting with the ground the way it usually does. Again, that's my little challenged foot, so it makes sense that this orthotic was trying to make it interact appropriately, and my foot was saying, yeah, I don't really like that. Again, it makes sense. It doesn't like being normal. So after that, it was not too long until I got onto the trail. Once I got onto the trail, that wasn't a problem. And I was fine. Left foot was fine after that. About a mile after that, I would say it was about when I was at my turnaround point, which is about 5 miles. Yeah, I think it was a little bit after I turned around. So maybe 5.5. My right foot, so this is my usually happy foot, wasn't feeling the orthotic at all. Still, right now, standing in them, don't feel the orthotic at all. My right foot, the Achilles tendon started getting really, really tight. So the Achilles tendon is on the back of your heel. It's where the gastroc and the soleus, the calf muscles, attach into, right? And it started getting really tight. And I started getting a little concerned about that because, I definitely, as a physical therapist, have seen many Achilles tendinitises that take a long, long time to heal. So I was a little bit concerned about that, kind of paid attention to it for the next mile or so, and then it seemed to go away, so I wasn't super concerned. So at the end of the 10-mile run, which again, don't do that with a new orthotic, you guys. But at the end of the 10-mile run, I would say overall, I felt like if you are an overpronator or you have difficulty with plantar fasciitis, these orthotics would potentially be helpful. I feel, like I said, on the left side, I don't feel like I have any support at all, but I know that that's not true. That's just because my left side is more challenged than my right. On my right side, it does feel like there's a lot, it almost feels like it's pushing my foot into a position it doesn't want to be on. But then again, I just ran 10 miles and really didn't have any problems long term. Obviously, I will let you know after I do my next run how that goes, and if I did find it and have any problems along the way. So, so you can join me on this journey. And I'm hoping two things. One, that you'll learn something about these particular orthotics, but also two, that you'll learn more about the journey anytime you're finding a new running shoe, walking shoe, hiking boot, orthotic, anything like that. So unfortunately, it's not like we put on that glass slipper and it fits perfectly and everything feels wonderful, right? There are some challenges along the way, and the challenge of the challenges is to figure out, okay, is this okay? Is this actually good for my foot? Is this going to be bad for my foot long term? So I'm hoping, as I share these thoughts with you guys and kind of what I'm experiencing with my body, that you'll not only learn about these orthotics, but that you'll learn about how I kind of objectively look at these situations. Because whenever we're changing anything with our body, whether I'm doing it with my hands, whether you're doing it with an orthotic or a new shoe, there are little twinges and tweaks and things like that. And they're not necessarily bad. It could just be your body is adapting to that, and it could actually be a good thing. Right now, I will tell you, my left hip feels super, super tired, deep tired, which tells me that those deep hip internal and external rotators got a really good workout on that 10-mile run. Now, you guys, I run 10 miles every single weekend, and I've done that for years, definitely as long as I've had the business at least, but even for years before that. So this is not a new thing for my body to do, and yet my hip is feeling really tired. So I can tell you that this orthotic, it didn't stress my hip more, it allowed my hip to activate more. So now my hip is more tired than it usually is. So that's actually a good thing, you guys, because my hips have been inherently weak because that's my wonky side. So again, it's looking at all those things. Bad doesn't necessarily mean bad. Good doesn't necessarily mean good. We got to look at the whole big picture together. So we'll look at this big picture together. I'll let you know how things go on my journey. Hopefully you'll learn kind of a little bit more about my thought process, and hopefully you'll ask questions along the way. And if you have other products that you've been interested in finding out more about, I'm definitely happy to share a review of those with you. All right, have a great day, everyone. Bye.